Hi, everybody. Welcome back to Dr. Mish Kogan and GW Center for Integrative Medicine YouTube channel. Today, we're going to have a brief chit chat about trauma, about HeartMath, biofeedback, and whatever else Yael needs to talk about. So Yael Flusberg has been with the center for, well, I can't remember how long, but for long. And Yael is our main yoga therapist, although now we also have Jennifer. Rue. I always screw that one up. I'll learn it eventually. So Jennifer is also our second yoga therapist. And today we decided to talk, not necessarily because of yoga, but because Yael just recently completed a pretty advanced certification in a resilient heart, trauma-sensitive HeartMath course. I'm a huge fan of HeartMath. At the end of this, I will put some links to the actual devices and to the HeartMath, of course. And the HeartMath is a very engaging biofeedback system, and Yael will tell us a lot more, but I've studied it, and I did the certification course, I don't know, 10 years ago, maybe 12, so quite a while ago. And I still use it periodically. It's a powerful tool when used in the right hands. You have to like technology, of course, to be able to use it. But even if you're not using it, but practitioner is using, when practitioner is seeing it, it can be very profound. So without further ado, Yael, tell us why you decided to take this course, what's up with the course, and what'd you learn?
Yeah, thank you, Misha. Actually, it's interesting because I took that same course that you did about a dozen years ago, about 10 years ago or so. And this one focuses a lot less on the technology and a lot more on the, what trauma is and what chronic stress is, because chronic stress can be as bad for your system, your nervous system, your immune system, your overall functioning as trauma. And the techniques, which you can use, the technology is great because it does give you feedback about what's happening inside your body. One of the things about trauma is we tend to think about it as an outside event or a situation, like living through a pandemic or going through a very intense grief period, or living through an act of terrorism, as we've been seeing in recent weeks. But in fact, trauma is not necessarily the outside event, but rather what happens inside of us, what's continuing to happen inside of our body, even decades after the actual external event or stressor. And it's that we can actually use very simple but powerful techniques to begin to shift. And one of them is HeartMath, which is based, it's very much science-based, which is why I think, Misha, you love it so much, because it really
It's very objective. It's like you do something, and then immediately on the screen, you see how your nervous system changes, how it adapts, how heart rate variability shifts within seconds. So I think it's for any physician who likes data-driven things, it's very, very attractive principle. Now, but you mentioned that
and it uses heart rate variability, which is really widely known and widely respected.
Right.
Yeah.
But you said that in this course and in this work, they're actually using the appliance less. So how come? Like, what are the specifics there?
I'm not sure. I don't know what their thinking was, but they certainly brought in a lot more information about what trauma was, and a lot more experts, a lot more physicians who work with trauma, folks who are working with refugee populations, folks who are working with adolescent and teens, to really, I think, understand, because trauma has become so popular. Mm-hmm. And I suspect that, like James Gordon over at Georgetown, mm-hmm. Who says it's not enough for us to have trauma-informed practices. We need to work towards becoming a trauma-conscious society. So I really think that part of their motivation is to teach more and more about what trauma actually is.
That's very, Jim is one of the elder wisest.
A gem.
Mentors. Yeah, a gem of a gym. And so he's absolutely right. So let's drop a little bit to a different direction. So you've been doing trauma informed work, whether it's a yoga or talk therapy or even your poetry, I mean, for I don't know how many decades. What do you think this is going to add to your practice? Like, how is it going to inform what you're going to do with your patients?
Yeah, it's a great question. What I love about the HeartMath is that it's super simple. Anyone could learn the techniques. You start really slowly, you could break things down. Because one of the things, and then you could sort of build up and people can have a sense of success, right? And a sense of getting more and more engaged in what's happening inside of them. So one of the most pernicious things I think about trauma is it takes away our ability to feel and connect to our bodies. So we become like super cerebral, which is also, in fact, if you think about this culture, that's how this culture is.
Yeah.
We're totally, we're just stuck in our heads. We do these obsessive loops. It's really hard for us. Even, in my yoga classes, obviously it's a little bit different because people are coming to do yoga, or even in my one-on-one yoga therapy sessions. And I do see over time, at first, what I might interpret or what other people might see as sort of clumsiness or klutziness is often not that. It's just often that, like, we don't know what side is our right and our left. We don't know when something is relaxed.
Yeah, we disconnected. I mean, we live
totally disconnected
of our time in our minds, so to speak, and we often forget that the body has its own language and its own expression. And the trauma expresses through the body just as loudly. We just often block it off. We don't want to hear it.
Right. And we can't, right? Because of the parts of the brain that actually get hijacked during trauma. So we often, one, can't actually understand what other people are saying to us. And two, we can't express ourselves as well when we're being hijacked or, the word is triggered. Yeah, I've always been circling around, and I think we're so lucky, really, it's in the last 15 years that we know much more about the neuroscience and how, if we look at Stephen Porges's work around polyvagal theory, I mean, his whole thing is also that there's more messages that come from the body up than from the brain down, right?
And I think that's what the HeartMath innately explores, that the heart sends just as many messages, and if you learn to regulate that, you're actually going to regulate the entire system, not just the pulse or the heart rate variability. So it's a very, very broad technique that can have implications for entire health and definitely for the way we think and the way we feel. I mean, it's a pretty profound technique. I was going to ask you, so logistically speaking, we do the HeartMath when we do one-on-one work. You do one-on-one work at the office. You can do that. What are some other ways that you can directly work with patients integrating this technology?
I mean, I actually think we could do HeartMath also online. It's something that's very, very easy to do. I wouldn't necessarily be able, if someone is at a distance, I wouldn't necessarily be able to look exactly at what's going on in their nervous system, which you can do when
probably,
you're in person.
Yeah, but I wonder if somebody is connected to their computer, they can share the screen. I don't know if
absolutely
try that. Yeah, so that definitely can work.
And I actually think that more people would probably be interested. So what Dr. Kogan is talking about is something called the N-Wave, and that you actually, it's a box-like piece of equipment, and that connects to a desktop. And that gives a practitioner a ton of information about what's happening with the person's nervous system. But something that's a little bit more affordable for most people and probably easier for most people to use is just called the Inner Balance. And that's something that can connect either to your iPhone or to an Android phone, and just connects to your little finger or to your ear. And that actually gives you quite a bit of information as well. And
I actually think in some way it's even better because it's a little bit simpler, and the amount of sophistication and data is about the same. but it's on your phone, and so it's a lot more mobile. It's a lot easier to. I feel like the desktop version is really more for research or for clinicians to assess the patient and then do something. But for the patients, I think once they introduce the EM balance, I think that's really more than enough. I agree.
Yeah, and I mean, honestly, like I've been introducing the HeartMath techniques in my group work, and also I do a lot of one-on-one coaching as well. And the coaching is more based in mindfulness, since I'm a yoga therapist. And people get a lot of benefit from it, whether or not they have the feedback piece, because as we start to feel more connected, you can actually start to feel the shift in heart rate variability, which I'm trying to, Bessel van der Kolk wrote about that in his book, The Body Keeps the Score. They actually attach like M waves, you know, the earlier version of the HeartMath technology, to people before and after a yoga class. And it turns out, surprise, surprise, your coherence is much better after a yoga class. And I think like that's just the good feeling that people have when they've been.
But it's a lot more than good feeling. I mean, we know when you come to that state of nervous system coherence or balance, you have profound shifts at every level. I mean, the nervous system balances itself out. You have hormonal regulation, you have decrease in cortisol, you have balanced, you know, if you're feeling states of anxiety, depression, they get balanced out. So it's not just like this little, oh, I just feel a little bit better, so tree hugging thing. No, it's very deep.
From the perspective of I was only speaking about the perspective of the person who knows that they feel better. They might not necessarily know what changes are going on internally, but they feel differently after a session than they did before.
Right. Well, we want to keep this short, so let's wrap it up. So people can find you just going to our website, gwcm.com. I think we have a little bit of information on the website, but we will put the links here in this YouTube video to both your page, but also to the HeartMath. And I guess what else you want to put there? We can put the Body Keeps the Score link. I think that would be a good.
That would be great.
Good link. It's very trauma informed. And do you want to give any other resources to your patients?
You know, the only other resource, I also, over the course of the pandemic, because what better time, I did a 240-hour course with a physician named Gabor Mate, who he writes a lot about addiction and ADHD and also trauma. He's my second favorite doctor, my third favorite, next to my husband, you, and then there's Gabor.
All right, I should feel very honored right now. Okay.
He has a program that's called Compassionate Inquiry, and it's really a somatic-based psychotherapeutic approach. So that's another approach that I've really used. And all of these approaches are really meant to be combined. So from the perspective of a person coming in who's like, I'd like to be a little bit more resilient, or I'm noticing that I'm just really, you know, flooding a lot. I'm really exhausted. I've got high pain levels. I can't seem to get back to my pre-pandemic, you know, ways of being. They might not necessarily know, I want this modality or that modality. And so I can sort of help figure out what would be most helpful.
Good. All right. Thank you, Yael. Thanks for continuously learning, never stopping. I think that's actually what generally I think is true about all of us. I can't speak to other clinics, but in our clinic, we always try to do that. And congratulations on this great achievement. And everybody have a good weekend. Bye.
Thanks. Bye.